Today there was a dissemination of findings about the incidence of abortion among adolescents in Uganda since 2013.
I attended the conference today because I've been working on a research study for the last few years in partnership with Makerere University School of Public Health.
Over 25 million women experience abortion annually.
The findings today are really a reality check, particularly for young people, because as you saw, 57,000 abortions occurring among adolescents is a very high number.
You know very well that abortion is a problem in this country with regards of its legality. The ambiguity is so much.
The first question is, how do we stop adolescents from having unintended pregnancies that they don't want to be having? How do we help support them make decisions to have contraceptive commodities that they want to be using? There's high rates of discontinuation, or they might not have the methods they want, or they may face judgment from their providers, and so how do we create a high quality service environment for them so that they are able to make the choices that they want to be making?
And basically what I think these results mean for us, what the findings mean for us, is that we should be able to inform policy on sexual and reproductive health, especially amongst adolescent girls.
In our country, we have a situation where young people are forced to grow up faster. They're forced to experience adult experiences in terms of, having to deal with pregnancy, having to think about how to manage the pregnancy, whether to have the child.
All started at a house party our friend recommended.
So as a country, we should accept that this is a problem. We should bring out emotions into this. Let's have some cautious that so many mothers are dying, so many young girls are dying because of these unsafe abortions.
We need to provide them the highest quality post-abortion care. That a lot of the severe complications sometimes come from delays in reaching care, or that they're not able to receive the highest quality of care in facilities. And so that means ensuring that post-abortion care is widely available, that it's destigmatized, that adolescents are aware of it and know where to go so that it's available to them. So I think it's sort of those two pieces together.
One key highlight is that there is not as much information for adolescents. They need to get accurate information regularly, but they also need to get services, youth-friendly services.
We really need to look at our statistics. We need to go back to the drawing board, and we need to fashion or to develop solutions that are very responsive to the realities that we're seeing.
These findings are going to help us in amplifying youth voices.
Let me stretch this side like this.
This is a call to all Ugandans, wherever you are. This is for you.
I want to thank Public Health Ambassadors of Uganda for their incredible work that they did organizing this event, and I think having that youth voice and drive, and you saw it with sort of the spoken word and theater and creative presence and voice in the panel, this is really important, that if we're talking about youth and adolescents, we need to have youth and adolescents be driving that conversation.